Alrighty, let's talk about a medication that we all know, something that we're all comfortable with. Let's talk about acetaminophen. So what's the trade name for acetaminophen? The most common one you're going to know is Tylenol. What are we giving this for? Well, we're giving it for pain, for fever. It's a very common medication you're going to give in the ICU, in the ED, in the med-surg floor, really wherever you work. Acetaminophen is something you're going to see and you're going to give very often. A lot of times with fever, you got a patient with like a 101 fever, you can give them a little bit of Tylenol, bring that fever down. A lot of times it's used in conjunction with other medications to help with pain, like Norco has acetaminophen, 350 Tylenol, 600 Tylenol. You can have different doses of Tylenol in there. Now, how does it actually work? We know what it does. We know why we give it. We know we're going to be giving it every single shift. How does it actually work? What it does is it actually inhibits the synthesis of prostaglandins. Okay, these prostaglandins play a role within our body in transmission of pain signals, fever response. It can also aid in inflammation. And so what we can do is we give this acetaminophen, and that inhibits that synthesis. So if we're not able to synthesize and create these prostaglandins, that's going to help pain, fever, inflammation from occurring. Its therapeutic class is antipyretic. So what does that mean? Pyretic, antipyretic means fever preventer, fever reducer, however you want to say it. It's also a non-opioid analgesic. So it can help with the pain without the opiate side effects that you're going to see. So what are some things that we need to keep in mind for a patient who's taking acetaminophen? First and foremost, the biggest one I want you to keep in mind is we should never exceed 4 grams of acetaminophen per day. Why do we do that? It actually helps reduce the risk of liver, renal, and cardiac damage. So one of the big things we're looking out for here is actually liver damage. Now, there's some studies that say it might actually be a little less than those 4 grams, but what we're going to say here are the 4 gram maximum limit. It sounds like a lot because we're giving it in doses of 300 or maybe 600, but if you give enough of it, if your patient is on Norco and you're also giving acetaminophen for another reason, it's very, very easy actually for them to get to that max limit in a single day. If they're taking Norco 350 and 10 every 4 hours for pain, very quickly you can see in a 24-hour period, they can actually get to their 4-gram dose. So it's really important that you actually let your patients know that as well so that they understand what's going on. Hopefully there's also, if it's a pain patient and they have Norco, hopefully there's another adjunct medication on there, like some morphine, 1 milligram morphine or something like that, where you could alternate. So every time you're giving pain medicine, you're not giving that Norco, that acetaminophen every single time. That can help with the pain, and it can also help to reduce how much acetaminophen the patient gets. Overdose of acetaminophen will lead to hepatotoxicity. If you've worked in a hospital, you've definitely seen a patient come in with Tylenol overdose. It's not a pretty experience. I know that seems weird that a household medication, an over-the-counter medication, could cause all these problems in a patient. But if you see a patient who's tried to take an entire bottle of Tylenol, it is not pretty. They're going to end up in the ICU. They're going to be there for a while. They're going to cause massive, massive liver damage. They're going to be intubated. They're going to pump the stomach. It is just not a pretty experience for this patient. The antidote for acetaminophen, if a patient does overdose, if you work in the ED or in the ICU, this is what you're going to see. The antidote is Acetadote. Acetadote is the antidote for acetaminophen. Another really important thing you want to keep in mind with acetaminophen is that it may increase the risk for bleeding when the patient is on warfarin therapy. So if we're already giving warfarin, Coumadin to a patient, adding Tylenol to that can actually increase the risk for bleeding with this patient. And it can also alter blood glucose measurement. This has been another episode of the MedMaster Podcast by Nursing.com. To get your free copy of the 140 Must-Know Meds textbook, head over to nursing.com/140meds. That's nursing.com/140meds. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.